Prevention. How can we prevent it? Whether you have family history or you don't, all of us want to prevent cancer. So what are some of the tips you have?
First of all, the good news is the lifestyle things and the actions that you can take for cancer prevention, risk reduction are actually consistent with other things. In other words, a healthy diet that's low in fat, that has lots of antioxidants because there's color in the food, are all good for all of your health. Things that are good for bone health are good for cancer health. Exercise, believe it or not, has a big impact, and it doesn't need to be that calisthenic 8 hours a day. 45 minutes a day of good walking can actually show a measurable difference in cancer. It's not no alcohol, but it's not excessive alcohol. Some of those things are surely true. And of course, no smoking. If anyone wants to argue that out, we don't need to go through that data, but it's true. And then, of course, really being diligent about screening. I'm going to confess to you, I'm a little worried just on anecdotal experience of women coming in with cancers that we can feel or that they felt at a higher rate than in the past. I think it's delayed from COVID mammograms. I think that even though we didn't drop our mammograms, I think people who might have gone in just didn't. And so we need to get back into believing in the importance of screening. I read a COVID thing the other day, and cancer has been the leading cause of death all through this period of time. So we just have to not forget how important that is.
And self-exams.
Self-awareness, self-exams, right. Yeah. Don't be afraid to come in. Remember, the main thing is that I also think people, especially if they know they haven't screened in a while, they get very worried. So I have two things to say about that because I'm a woman and I know that psychology. You go in, you're a fresh start. It's a clear mammogram. Nothing that you delayed in the past matters anywhere. You're on time and you can be on time from that point. So you get the reassurance of everything is fine. And the second is that even if we find something, the survival rate's very high. Many women can get lumpectomies. Many women can preserve their breasts. There's so many options there. So I just think it's not being afraid to pursue the screening because you're afraid of what they're going to find.